Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us today is Dr. Deena Hinshaw, Chief Medical Officer of Health. As always, Dr. Hinshaw will provide a brief update and then we'll open the floor to questions. I'll now turn it over to Dr. Hinshaw.
Thank you, Zoe, and good afternoon, everyone. Earlier today, I was speaking with a group of municipal administrators about COVID-19. I was feeling frustrated by something that had happened just before that call, and I was speaking more sharply than I intended to that group. I want to express my thanks to the person in that group who gently reminded me that we were all on the same side, working together towards the same goal. I needed that reminder, and I wonder if others need that too. We are all so tired right now, and the stakes are so very high. The real human costs of unemployment, bankrupt businesses, and isolation are costs of social restrictions that we would all like to avoid. The real human costs of increased deaths, strain on the health system, exhausted healthcare workers, and delayed access to care for things other than COVID are also costs that none of us want to pay. We are in a terrible situation, and it is COVID-19 that is the problem, not each other. Please be kind to each other, and also remember that the only way forward is to work together, across differences, listening to each other, and minimizing both sides of those human costs to the best of our ability. We are all on Team Alberta. We need to remember that. Over the past 24 hours, we have identified 732 new cases of COVID-19 and have completed approximately 13,000 tests. This means our provincial positivity rate sits at about 5.5%, and we currently have 10,057 active cases. There are 287 people in hospital. Of those, 57 are in the ICU. I continue to be concerned about these numbers, as the human costs of COVID are rising rapidly. As I have said before, as cases of COVID-19 continue to rise provincially, we are seeing a corresponding rise in COVID-related hospitalizations, ICU admissions, and an increase in the number of frontline healthcare workers who are off work because of a potential COVID exposure and the need to self-isolate. AHS initiated surge capacity measures in Edmonton Zone in early November and continues to implement these measures in Edmonton Zone and other zones as needed. AHS is able to increase the amount of hospital spaces available to patients with COVID if they reduce the number of other patients in hospital. This means reducing the amount of scheduled or elective surgeries and other procedures that might require overnight stays in hospital and reducing the number of ambulatory clinic visits. AHS also has contingency plans in place to ensure beds are available if needed to provide care for patients with COVID-19. Hospital sites are increasing spaces that may be required for COVID-19 patients by opening units not currently in operation and equipping and maximizing other spaces in a safe manner. As part of its surge capacity planning, AHS is also increasing ICU capacity across the province. AHS has the ability to create temporary ICU space in spaces that would otherwise be used to care for patients who have other conditions requiring specialized care, such as cardiac units, post-operative recovery areas, and other areas able to support ventilators and cardiac monitoring. In short, AHS is preparing and working hard to meet demands. But there are consequences to these measures in delayed access to non-COVID care, and there is a ceiling to capacity expansion. We need Albertans to do their part. By working together to reduce the spread of COVID-19 in the community, we can reduce the need for hospitalization and demands on our hospitals and emergency departments. Turning to schools, there are currently active alerts or outbreaks in 320 schools, about 13% of all schools in Alberta. This number includes 64 schools that are currently on the watch list. So far, in-school transmission has likely occurred in 157 schools. Of these, about 83 had only one new case as a result. Sadly, I must report 11 new deaths over the past 24 hours. My condolences go out to the loved ones and friends who are mourning every one of these lost lives, not just today, but since the pandemic began. We have lost Albertans to other causes in this time as well, and they are also mourned and missed. But the difference is that we did not have the collective power to prevent all those other deaths. With COVID-19, we do have that power. Almost a quarter of all our COVID-19 deaths have happened since November 1st. If we do not change our trajectory, the implications are grim. The daily COVID-19 death count is a tragic reminder that COVID-19 is not just a flu. It is life and death. And often it is the outcome of choices made by Albertans who may not even know the victims. Almost 1 in 3 cases are getting sick from sources we can't identify. We know that overall, as of November 15th, about 40% of cases are linked to a household or social gathering or private event. 10% are linked to continuing care, 4% to childcare or K-12 schools, and 3% to acute care outbreaks. But for 30%, the source remains unknown. Over the last few weeks, and as we have faced challenges in achieving timely contact tracing, that number is also rising. Every day, about 250 to 350 people are getting sick, and we have been unable to identify the source of transmission. This puts us all at greater risk. This is why we put in place the measures we did last week. The measures are focused on settings where there is the highest risk of one case spreading to many if there is a slip in public health measures. I am disappointed at reports of organizations and businesses that are trying to find loopholes in the order and are continuing activities. I have seen examples of fitness studios running group classes with a video rather than an instructor. Some team sport practices have continued by moving to a neighboring community's rink, and some teams continue to socialize together simply because they're in a cohort as a team. I recognize that many groups have done incredible work to go above and beyond the measures in place. I want to thank all groups and individuals who have made that effort. Other teams or businesses may feel as if they are doing nothing wrong. Let me be clear. The intent of these measures is to facilitate a 2-week hard stop of all activity that can provide opportunity for large-scale COVID spread. I have heard people say that while we have communicated this is just for 2 weeks, they believe it will last longer, so they don't want to comply. We cannot create a self-fulfilling prophecy. Any individual, group, or business that chooses to continue is putting at risk the time-limited nature of these restrictions. These actions risk not just further restrictions on their own businesses and activities, but further restrictions for all those who are choosing to comply and going above and beyond as well. This is deadly serious. I have asked for kindness, but I also ask for firmness. The need to control our spread and protect our health system is why I ask everyone, anywhere in the province, to abide by all public health measures. As individuals, I can't emphasize enough how important it is to stay home and get tested if you have symptoms. Albertans cannot write off symptoms as just a cold. What is a mild illness to many is deadly to some. Albertans cannot avoid testing because it's inconvenient or because they don't want to get their party host in trouble. They cannot fear that a positive result will make them unpopular with their friends. We need to view every gas pump, every walk through a mall, every pass through a store door, every stair railing or escalator as an opportunity to prevent COVID spread. With unknown transmission sources at current levels, there are cases that we still don't know about. Every one that spreads is a threat to the health of others. Every one that spreads is a threat to the healthcare system. Every one that spreads means the potential for more intrusive measures in the future. My sincere thanks go to the many, many Albertans, most Albertans, who are washing hands, staying distant from those outside their household, wearing masks, keeping their cohorts small, and respecting the measures in place in their communities. My heartfelt thanks and appreciation go out to the healthcare workers who are working heroically to ensure our healthcare system has the capacity to meet the demands of rising hospitalization and ICU numbers. My thanks and encouragement go to all individuals working in COVID assessment centres and the lab who are helping us stay on top of the need and demand for rapid testing. And special thanks go to the contact tracers who are working to address the backlog of contact tracing work that will help us increase our understanding about sources of transmission. Alberta, we can still bend the curve if we work together, if we live by the same rules, if we take the same precautions, if we believe in a common goal. We can slow the spread. In fact, coming together is the only way we can. Thank you, and I'm happy to take questions.
Thank you, Dr. Hinshaw. We'll now go to the phones. Please limit yourself to one question due to the number of callers in the queue today. Operator, could you please put through the first caller?
Our first question comes from Rick Bell of the Calgary Sun. Your line is open.
Good afternoon, Doctor. Just a very simple question. It might be a hard one, but it's simple and short. A lot of readers of mine are asking for a little more specific indication of where we would be headed if this virus does not come under control. You've talked many times about, as has the Premier, about contemplating further restrictions. Today you said more intrusive measures. But what does that actually look like? What is the end game specifically if this virus if these numbers continue to mount? Is it, for instance, a 28-day circuit breaker lockdown as the City of Calgary's Tom Sampson suggested? Is it going back to what it was like in the spring where non-essential businesses were shut down? I'm just throwing those things out. I'm not recommending them, obviously. But so can you just tell Albertans what does the future look like if the virus we don't get this thing under control, as opposed to just saying more restrictions? Thank you.
Thank you. And I know that we've heard from many people who want to know not just what those additional restrictions would look like, but what exactly are the metrics that would indicate to us that we need to take that step. And I recognize that increased kind of setting that playing field and having metrics that everyone can see and watch how they're changing, and having that certainty about what that next step measure is going to look like would be helpful for many, not just in general Albertans, but also for those in the business community. One of the challenges that we face is the fact that we have been focused very, very closely on monitoring our own data and putting measures in place that are focused on where we have seen spreading events and the activities that we see as being a risk. And one of the challenges we're facing right now with the case increase in the backlog and contact tracing is we don't have the same kind of robust data that we used to have. So the decisions about what that next step would look like have not yet been made. Essentially, additional restrictions would be put in place to limit the number of times and places that people are in close contact with one another. And what that looks like, where those places would be, what kinds of restrictions, again, have not been determined. And that, again, is going to be a balance of looking at what data we do have in Alberta and then using what we've seen in other jurisdictions as the evidence of how COVID spreads. But again, we are in a challenging time because we are moving from having more detailed data to having less, and we do have to strike that balance of still wanting to focus on the areas that we see are a problem, and at the same time knowing that with the increase in unknown transmission, we may need to take broader measures. But again, I'm sorry we don't have a determination on specifically what that would look like.
Operator, could you please put through the next caller?
Our next question comes from Janice Johnson of CBC. Your line is open.
Thank you very much. Dr. Hinshaw, earlier today, the health minister in Ontario announced that they were going to be getting 2.4 million doses of vaccine between January and March of next year. What numbers have been promised to Albertans?
I believe our health minister has issued a statement about that just this afternoon. And so what we anticipate, and I want to be clear that these numbers, of course, depend on many factors. They depend on the final pieces of the trials that are underway going well. They depend on ensuring that the safety and effectiveness of the early vaccines can be assured. So all of those checks and balances must be cleared. If that does happen, because there is a per capita allocation of vaccine, we are anticipating that we would be receiving approximately 465,000 doses of the Pfizer product and approximately 221,000 doses of the Moderna product. So we would be sitting at approximately, again, 680,000 doses of vaccine with those two products combined, assuming that all of those steps that need to be cleared are able to be cleared in a timely way.
Operator, could you put
Next
through?
question.
Go ahead,
Our
operator.
next question comes from Lauren Boosby of the Edmonton Journal. Your line is open.
Hi, Dr. Hinshaw. I wonder if you have a date about when we can expect to see the 400-some contact tracers up and running. Before you said that was within weeks. Can you be more specific, like maybe December 1st or something? Also on the ICU beds, before we knew that there were 70 of them for COVID patients and that 50% capacity would trigger additional measures. So if there's 57 patients there right now, that's 81% capacity. I know you said that you can expand it, but and you brought in some new restrictions recently, but do you know how, if you're going to wait and see until those restrictions work, like how bad does it have to get before we see more measures come in?
Thanks for those questions. With respect to the exact timing of contact tracers, that would probably be a better question for Alberta Health Services. I have been in contact with them, and of course, we in the ministry want to do everything we can to help Alberta Health Services move that process quickly, but they would have a better knowledge of the exact processes, the HR processes for hiring and training, and so that may be something we can ask them to get that data for you. With respect to the additional measures, as you say, we did hit that trigger and have exceeded it significantly. And there was a suite of measures that came into place last Friday. We are, of course, watching very closely. We understand that the numbers, based on what we know about COVID, that the numbers of cases that we see today will translate into numbers of hospitalizations and ICU admissions in a week to 10 days. We anticipate that we will see those numbers in acute care continue to rise based on the fact that we have seen in the past week to 10 days a high number of COVID cases. However, we are watching, again, that acute care trajectory. We are also watching our current COVID cases. And we are watching the ability and dedication of Albertans to follow the public health measures that are in place. And those are all factors in whether or not we will need to implement additional measures. And I just want to emphasize that the future of this province is in all of our hands collectively. And we do need to work together to bring this pandemic under control, whether that's with additional formal measures or whether that is with the measures we currently have in place that are embraced and followed in every community in this province.
Our next question comes from Jeff Slack of 660 News. Your line is open.
Hi, Dr. Hinshaw. I believe BC and Ontario are looking at starting an early Christmas break for schools. I'm just wondering if Alberta is considering this same thing to help reduce the spread of COVID-19.
We certainly are in discussions with education on a continuous basis to make sure we're monitoring the situation in schools and looking at options. But no decisions have been made at this point about any changes to the school model. So any information about whether or not that might happen in Alberta would be forthcoming.
Operator, could you put through the next question, please?
Our next question comes from Julia Wong of Global News. Your line is open.
Hi, Dr. Hinshaw. BC is pushing for travel restrictions between provinces. What discussions may or may not be happening about travel restrictions between provinces and travel restrictions within Alberta itself, particularly, as you were saying earlier, if people are trying to do activities in non-hotspots? And should Albertans be traveling this Christmas?
With respect to travel within Alberta, as you know, we have strongly recommended that Albertans who are in enhanced areas not move their social activities outside those enhanced areas. At the moment, that isn't a formal ban, but again, we are strongly encouraging Albertans to not make that choice. With respect to interprovincial travel, that has not been a conversation that I personally have been a part of, and that would be a policy decision that would need to be made based on discussions around what interprovincial travel restrictions would look like as a national kind of framework.
Operator, could you please put through the next question?
Andrew Brown of CBC Calgary, your line is open.
Hi, Dr. Hinshaw. We recently spoke to American infectious disease expert Dr. Anthony Fauci, and I'd like to quote him quickly. He says, "We've got to be able to test widely in the community for asymptomatic spreaders. If you just test those who are symptomatic, you're going to miss a very large contingent of the spread of infection in the community." Alberta is, of course, no longer doing asymptomatic testing for people with no known exposure to COVID. My question is, could that change, and what do you think of Dr. Fauci's comments?
I think he's exactly right, and that's exactly why we continue to test broadly anyone who has had any contact with a case of COVID, anyone who's involved in an outbreak, because we know that when people have contact with somebody who has COVID, they have a much higher risk of testing positive. We know from our broad testing in the community that the risk of somebody with no known exposure and no symptoms testing positive is extremely small, and our testing resources need to be focused on the areas where they matter most, because in addition to the importance of testing people who are asymptomatic, who've had an exposure or a part of an outbreak, it is absolutely critical that we're able to provide the test result information to individuals as quickly as possible, starting from either their onset of symptoms or when they recognize that they have been exposed to somebody with COVID. So I would interpret his assertion that we need to be testing for asymptomatic spread in the community to be exactly what we're doing, which is focusing on those who have had exposures so that we can limit further onward spread from individual cases of COVID and to minimize the spread of outbreaks.
Operator, please put through the next caller.
Our next question comes from Kevin Nimick of CTV. Your line is open.
Hi, Dr. Hinshaw. Junior A hockey is still allowed to have cohorts of up to 150 people. I'm looking at a schedule right now for a team from Okotoks who's set to play 4 different teams from different communities in the next 13 days. Why is this allowed, and why are hockey players in that younger age group, 17 to 21, allowed privileges that other athletes aren't?
The teams that are allowed to continue playing are those teams that are complying with the additional very strict measures that are in our junior, collegiate, and semi-professional guidance, which involves additional restrictions, including restrictions on their activities. And so that particular guidance is much stricter than the general sport guidance that is applicable to amateur sports or other sports contexts. And so there was a decision that was made to allow those particular sports groups to continue based on the additional restrictions in that guidance. But I want to emphasize something that I think is a misunderstanding. Those individuals on those teams should absolutely not be socializing together outside of their play. So the cohort in a sports group allows them to play the game together, but they should not be having any close contact that can be avoided in the dressing room, in off-ice time, in social settings. That should stop, and so it really is only that gameplay under those strict restrictions in that additional level of guidance that's allowed to continue at this time.
Thank you, Operator. Could you please put through the next caller?
Our next question comes from Jesse Weisner of Global TV. Your line is open.
Hi, Dr. Hinshaw. There's been some mixed messaging surrounding what Albertans should and shouldn't be doing. Yesterday, Dr. Tam asked people to only go on essential outings, and yet several Christmas-related and other events are still happening across Alberta, and places like the West Edmonton Mall Water Park are still open. How can Albertans know what to do if they're being told different things from the city, federal, and provincial level? What's your directive, and should we only be going on essential outings?
So Dr. Tam needs to make recommendations that are broadly applicable across the country. In Alberta, again, what we have been focusing on is the restrictions that target the areas where we have seen large spreading events. Of course, as you mentioned, there are certain activities that remain open because we have not seen significant spread in those settings. However, as I mentioned earlier, what we need Albertans to do right now is to follow all the public health guidance in every setting. And so that involves, if they are, for example, going shopping, that they should be staying distanced from others. They should be wearing a mask when they're in an indoor public space, where it's possible they may not be able to stay distanced at all times. Making sure if they're sick, they stay home. Those are the things that Albertans should be regularly doing. And with respect to knowing what additional measures need to be followed, I would encourage Albertans to use the relaunch map online. Albertans can sign up to receive a text or email alert when the area that they're interested in changes. So when it changes from an open level to an enhanced level, then they would automatically get a notification. And so I would encourage people, when they're confused about what to do in different places in the province, if they sign up for those alerts, they will get immediate notification when there are any changes, and they will understand what the list of things that are restricted are in that community that they belong to.
So we have time for about 3 more questions this afternoon. Operator, could you please put through the next question?
Our next question comes from Jason Herring of Post Media. Your line is open.
Good afternoon, Dr. Hinshaw. You said in the past that some 10% of COVID-19 cases had gone to work while they were symptomatic. I'm wondering why you think that this is happening and whether you think more supports are needed to stop this behavior.
I think there could potentially be a few contributing factors, and unfortunately I don't have detailed information on that 10% and the specific reasons behind making that choice. But what I believe, based on my conversations with my local colleagues, is that there are a few motivations. One is the fear of loss of income, and there may be people who are not aware of the income supports that are available. And that's one of the reasons that I spoke about that earlier this week. And we have been working with Alberta Health Services and partner ministries to make sure that that information is available at all places where someone might need to access it. So for example, when someone goes online to sign up for a swab, if they're symptomatic, making sure that the information about income supports is available right at that point on the website so that they know if they're feeling symptomatic, with the specific list of symptoms like a cough or a fever that require them to stay home for 10 days, they know exactly where to go to get that income support. And so we are taking those measures, but I believe that is a part of why people go to work. Another part could be, and again, this is speculation, and I don't have the data from all of these cases to back it up, but again, based on some of the reports I've received, is that people may have gone to work in the morning and they start feeling sick and then don't necessarily want to leave work in the middle of the day. And so I think we need to make it easier both for employees and for employers to be able to think about what is the backup plan. And so for each employer to have a plan about what would they do if one of their employees at work starts to feel ill in the middle of the day. How can they support that person to be able to leave as soon as possible and to be able to cover off that work for the remainder of that day? Because I think some people, again, if that sickness starts during a shift, they may feel obligated to stay and work it out. And I really want to encourage employers to have a workplace plan for how to respond should that happen, and to encourage their employees to tell them as soon as they start to feel symptoms that they would need to be excused from work right away and not finish out their shift.
Thank you. Operator, could you please put through our penultimate question?
Our next question comes from Carl Bissett of CTV. Your line is open.
Hi, Dr. Hinshaw. I'd like to build on a question that you got a couple questions back just about sports teams. And I know the previous question was about junior hockey, but when it comes to the teams that, as you mentioned, maybe looking for loopholes to allow them to keep practicing and in some cases socializing, are those loopholes that can be closed simply, or is that something AHS is considering? How are you addressing that?
Certainly, we can implement more restrictive measures that would eliminate all gameplay, all practice, and all sporting activity. We had tried in our order to facilitate individual fitness activities, knowing how important it is for people to remain active for both physical and mental health. However, if the intention of that order, which was to facilitate those individual fitness activities, is exploited, we may have to consider additional restrictive measures that would close that opportunity, which I do not want to do. However, again, if that is what is required to close that loophole, we will have to look at that possibility.
And operator, could you please put through our final question for today?
Our final question for today comes from Carrie Tate of the Globe and Mail. Your line is open.
Hi, thanks for taking my question, Dr. Hinshaw. I'm wondering what the province is doing to help seniors who may not be able to get into continuing care spots as the healthcare system gets backed up. Is there any way that you're trying to alleviate that pressure?
Our teams at the ministry are working with Alberta Health Services and operators to look at options for being able to facilitate access to care, and that could unfortunately include people needing to go to a location other than their first choice for a first placement. But unfortunately, we are in extraordinary times, and with the number of continuing care outbreaks that we have right now, it's not appropriate to have somebody from the community move into a facility that's currently on an outbreak, as that could potentially put them at risk of exposure. And so we are working again with operators and AHS to look at all potential options to expand the access that people need. However, unfortunately, again, it may involve taking placements that could put them in their initial placement further from family and friends. So there are trade-offs to that, but we are working through those options with those partners.
That concludes today's availability. Thank you very much for participating. We'll be back again with another update on Friday.